Hello from Afghanistan. Women, children, and adolescents in Afghanistan tell us they need better access to health services, quality, respectful care, gender equality, social protections, and protection from violence. So I'm here at the Ministry of Public Health of Afghanistan to ask our Public Health Minister, Dr. Ahmed Javad Osmani, about his plans in these areas. Your Excellency, what proportion of the health expenditure is allocated to reproductive, maternal, newborn, child, and adolescent health, or PMNCH, in Afghanistan?
Thank you. We have two main platforms of healthcare provision in the country. The first is the basic package of health services, the BPHs, and the second is the essential package of hospital services, EPHs. Around 70% of all the expenditure in the health in these two packages are on the PMNCH services.
Why do you think investment in PMNCH is important?
We believe investment in PMNCH is the investment for the future of Afghanistan. With healthy mothers and healthy children, we can create a peaceful and prosperous Afghanistan.
Minister Osmani, what are your main interventions in PMNCH in Afghanistan?
Thank you. In Afghanistan, we had a number of successful interventions and stories regarding the mothers and children services. The first one was the defining of the priority health program of BPHs and EPHs, and the second was the training of the community midwives and community nurses in the very remote places of the country. Considering those successful stories, we would take innovative interventions to reach and provide access to every mother and every children in the very remote places of the country. First of all, we were in the frame of the new health program. We call it Health Transformation Program. We would establish family health houses in each village of the country, so the women and children would have access to very basic primary health care services in each places. The second would be the establishment of the emergency hospitals in each district of each 34 provinces of the country, so the mothers and children would have access to emergency services. And the third would be the expanding the polio eradication program and also the routine immunization program to very remote and inaccessible areas. And the fourth would be to have targeted programs and services to very vulnerable population, including IDPs, coaches, and those affected by the COVID-19 and other disasters.
Minister Osmani, how can you support community engagement in monitoring and following up your commitments?
As a minister, I am not a leader, but I am a servant of the people. People can directly contact me for accountability, or my team, or the Minister of the Public Health, or through the established mechanisms of accountability at the level of the health facility. We have health shuras or health councils. We have the community health programs, and also we have the parliament members through whom they can contact and make accountable the Ministry of the Public Health.
Your Excellency, may I come back in 6 months' time to see you again and follow up on the progress of your plans?
My pleasure would be to update you on the progress after 6 months.
Minister Osmani, I have one extra question about COVID-19, not about PMNCH. Please tell us about the financial commitments of the government of the Islamic Republic of Afghanistan regarding COVID-19.
Thank you. The leadership of the government of Afghanistan, not only regarding the financial contribution, but also for the political support of the COVID-19 and the support of the whole government and whole society approach, is an example in the region and also in the world. All the government structure, from the president office to the provincial public health offices to the governor offices and all the government departments were for the supporting the Ministry of the Public Health and fighting against COVID-19. So this was very much different regarding the COVID-19 fighting in Afghanistan. And regarding the financial contribution, around $50 to $60 million from the budget allocation from different government departments to the Ministry of the Public Health and also to the provincial governors came to the budget of the COVID-19, and that was also a very timely decision of the leadership of the government of Afghanistan. I am personally committed to improving the health of mothers and children, and I am dedicated to allocate right and adequate resources for improving the health of mothers and children through investment in our PMNCH services.